So today we have a great conversation with Dr. Will Oglesby. He is a primary care physician who does family medicine. We talked about prevention, weight loss, and some of the things that he has seen in his practice. So I'm excited for him to be on. I'm excited for you guys to listen to this and get great information on what you can do to prevent diseases and to lose weight as well. Dr. Oglesby, thanks for joining us on our podcast. I appreciate it.
Thank you for having me.
So tell us a little bit about yourself. Like, where'd you grow up? What got you into medicine? Tell us a little about yourself.
So I grew up in Pecos, Texas, small town. Whenever I was growing up, I think there were about 8,000 people, give or take. It's gotten quite large now because of the oil boom. And so that definitely is something that's going on. But I went to undergrad in Fort Worth at TCU. And so don't tell anybody, but I'm kind of like a Horned Frog fan first and then Raider second. But did do medical school at El Paso, Texas Tech El Paso, and a few courses here while I was getting everything ready. And then I went to residency in Pittsburgh, Texas and Tyler, Texas for family medicine. And really, I got into medicine initially because I was a teacher before. And so whenever I graduated school, I didn't know if I was ready to go into medicine. I knew I had an inkling, but I wasn't mature enough. And so, I went home and they were like, hey, you want to coach? And I was like, sure, why not? I guess I don't have a paycheck. So I coached swimming for a good amount of time. It was probably 3 years, and then I did IT for a little while, and then I was ready to go back. And so, and I decided I wanted to go into medicine pretty much like it was my grandfather. He was diagnosed with cancer.
Oh, I'm sorry.
No, yeah, it was gastric cancer. He'd been a pipe smoker. He was in World War II, and so there were a lot of things that he were exposed to. But I remember going to the oncology visits with him. I drove him whenever I was in high school, 18 to 20. And really it was the doctors that were there, the way they cared for him, the effort that they put into answering his questions, and just kind of going through the whole process. And it really did open my eyes up to, just providing patient care and being open and listening. I feel like, that's the thing. And then walking people through that process, which we do in primary a lot. I can think of several patients right now that, walking through that, and, oncology is leading, but I'm like, hey, if you ever need anything, feel free.
So that's a pretty amazing story. So what about that experience specifically that kind of motivates you to go into medicine? Because that's a pretty profound experience to have when you're young.
Right.
And to have that. So what was that about, the experience of being around those doctors that made you want to go into medicine?
It really was how they took care of my granddad, the way that they did it. And so, like, obviously, whenever you're going through, you get the initial diagnosis, you walk through and then they go through everything. But then there's always these subsequent follow-ups. And so each one of these, follow-ups, they would take the time to say, like, hey, how are you doing? Like, is there anything wrong with the chemotherapy? Is there anything that you're having, abnormalities, side effects to? Obviously, just things that you would generally ask. But it was really the compassion, I would say, that drove me to see, like, hey, that this is kind of what I want to do.
And so why did you choose family medicine and primary care? What was your decision for that?
I want to try and stop before, specifically, like, if I can get a smoker, if I can get 1 of 20 smokers to stop, man, I feel like that's a win. If I can get, whatever it is, the cervical cancer screening, if I can get any, people don't like necessarily the vaccine status right now, but, HPV vaccine prevents cervical cancer. And so, I'm all on board on that. Like, to the extent to where I feel like I got it because some of the serotypes have been associated with head and neck cancer. And so, yes, there hadn't been a study that proves that. But at the same time, I guess not intuitively, but it does make sense that if those serotypes are involved, that yes, it may prevent head and neck cancer. So, vaccine prevention, cancer prevention, and any kind of bad habit and then weight loss too, like any kind of, if I can motivate someone to essentially be better, then I want to try and do that. And I want to prevent, cancer from happening. The reason I couldn't be an oncologist is almost for the same reason that I appreciated them. But yeah, some of the stories are very hard.
Yeah.
And I definitely respect their specialty and how much effort they put into it. But yes, I don't think I could walk through and have that conversation every day over and over.
Yeah, that's hard. I mean, I can't imagine either.
Yeah.
So I think you're exactly right. Screening is probably the best way to prevent pretty much any disease that's out there, whether it's heart disease, cancer, or smoking, like you mentioned. What are some of the struggles you have noticed with patients, or even in your practice, with implementing screening? It seems a little bit more difficult with the way things are going on right now.
Yeah, I mean, part of it is like finance, but usually I would say, and Cologuard's being pushed for the colon cancer screening too. And really, to me, it's like, just pick something. I'll push whatever. Yes, 45 is the new guideline, and I know I'm definitely like, I think it's probably going to get lower. I don't know about what you think, but I can think of one specific patient, although this was an anomaly, but she was 21. And all of a sudden, stage 4.
Yeah.
And no genetic mutation. The only thing was she had a little bit of abdominal pain a year before, and it went away. Finance is a big one, particularly if cost is going to be in the way.
Yeah.
That's one of the barriers. And then do we actually need it? Like breast cancer screening, like mammograms usually, all of these are usually covered almost 100% by insurance plans, except for maybe deductible and that stuff. But I don't want to get like my breast tissue pressed, or I don't want to go through the cervical cancer screening deal. Almost probably like the colonoscopy, like not necessarily everybody wants to, go through that process. But at the same time, if you really do educate patients as to why we do it, and you talk about, number one, if we catch something early, we can do something about it before it becomes something terrible. And that's really what it's all about. Same thing with the smoking. We talk about whatever medicine. I was like, hey man, you can do whatever you want. You can try nicotine replacement. If you want to do medicine, you can do medicine. But they always have to be willing to take the first step. Yeah. And so it's almost like with screening too. Like they have to be willing to like, hey, what step do I need to take? Or do you think I really need this? And yeah, I mean, I definitely tell them 100% they need it. But I do have some patients that they're just going to do and what they want to do. And I respect that too, because that's part of my deal, and part of respecting patients is essentially they have autonomy. You just essentially go over like, hey, this is why we do it. This is why it's good for you. If you don't want to do it, that's fine, but this is the risk. I've had that conversation multiple times.
So what do you think motivates the patient to decide, hey, this time I'm going to go ahead and get that colonoscopy, or this time I'm going to get that nicotine patch? Like, do you feel like there's something in common that makes people want to do it as opposed to those who don't? Like, what do you feel like that kind of secret sauce is, so to speak?
That is a hard one. I think there are always going to be the people that believe in standard of care, and they think that as doctors, we're trying to do what's best. And then there's always some people that are saying like, okay, well, I'm kind of questioning, do I actually need this? Do I not need this? But usually you'll find, hey, my friend had a colon screening and they found polyps. That's usually the first step. Or, hey, maybe my friend smoked for a while and now he has COPD. And maybe if I stop it, I can get it ahead of time. Usually it's probably some sort of combination of a family member or someone that's been affected by the screening that really motivates them to do it as well.
So you mentioned you had that young girl who was 21 and having stage 4 colon cancer. Have you had situations where you've had surprises like that, where someone did come in with a vague symptom and ended up being something significant like that?
She was the one that really stood out to me just because of the age. Yeah, I can think of a few.
I'm curious as to why you think that we're seeing some of these things early on.
So it's hard to say. If you want to put on my conspiracy hat, it's microplastics. But as far as the data behind that, I haven't really gone into that. But, diet, what are they putting in our foods as far as like, antibiotics and all that other stuff? Who's to say? There haven't really been any studies along those lines to determine that. And people are living longer too. But as far as the earlier, man, I think of mutations from something, and if I had to guess, the amount of plastics, but that's just a guesstimation.
You're right. I thought about this more. Because I do think there is something in the way that we're either making our food, eating our food, cooking our food that is seen it. Because I myself, obviously in my field, I'm seeing more and more younger individuals having colon cancer, pancreatic cancer, esophageal cancer, and the only thing I can see that's common is either what we're eating, what's in our food, how we're eating, or something along those lines. I mean, what do you think about that?
No, I mean, I'm thinking that's a very high likelihood. You know, in medical school, they always say like pancreatic cancer, these people are smokers. I would say a lot of them at least have that kind of, or exposure, the ones that I can think of off the top. But as far as like the colon cancer at a younger age, like, you know, no, they're not usually smokers. And especially like the 21-year-old, it was, I mean, she didn't do anything but what she was supposed to do, go to school and do all those things. And so, I mean, there's definitely some sort of component environmental that is playing a role. Will we figure it out soon? I don't know. And what we will do about it. Because right now, you know, with the amount of stuff and manufactured, like there has to be strict regulations if they figure out what it is. But research and time and money, who's going to put that into it to, you know, figure it out? Yeah. I don't know.
So how exactly do you advise your patients if they come to you for like, you know, hey, I want to lose weight, I want to try some dietary options, natural options. Like, what do you actually tell those patients? Because we have a lot of options that are out there, including the GLP-1s.
Right.
So tell us a little bit about your experience about kind of diet, weight loss, you know, things like that.
So obesity is definitely something that's been known to cause cancer because of the inflammation and stuff. And so yes, if we can, as a primary prevention person, we're trying to prevent whatever it is that we can do to decrease that risk. So usually, number one, I have to see and gauge, you know, have they done anything? That's number one. And so everybody thinks, you know, there is a magic pill, and right now there may be a little bit of a magic injectable, but really a patient has to put forth the effort, and they have to be recognized like this is the best thing for their health. And so part of that is motivation, talking to them, say like, okay, well, you know, number one, what's your eating habit like? But usually eating healthier is an encouragement. Sometimes limiting calories, you know, is a good idea. People can try whatever diet they want as long as, number one, there's a little bit of data behind it. But a lot of times, like whether it's Nutrisystem or whatever it is, it's about portion control. And in America, we have a hard time. You go to a restaurant, you know, and then you look at the calorie count. It's like, you know, 2,000 calories in one meal, and you're like, okay, that'll do it. And then we're almost enduranced to eat that whole plate. But we do talk about medicine, and I essentially walk them through, you know, the different medicine options that they have, whether it be Qsymia, Contrave, their ingredients, because not everybody will be able to afford the brand name of those medications. They're still $300 out of, you know, and because insurance hardly covers those things. And then we talk about the GLP-1 injectables, whether it's Wegovy, Zepbound, and I don't necessarily do compounded at mine, although there are some other ones that'll do it, mainly because the FDA, they kind of, you know, poo-pooed on it right now. But it's still kind of in limbo. But I do say there's online platforms, and as long as you get it from a reliable pharmacy, I think part of it is like people are selling it out of the back of their car, and so that's definitely not where you want to go. But I tell them to call your insurance company, see what they cover, because that's step one. And a lot of times it's like, well, we don't cover anything. And it's like, okay, well, now what do we do? Getting into a nutritionist is also a good idea, just so that they can essentially see, you know, where it is in their diet that they're missing or really going over, I mean. But, you know, right now I think UMC Perks is doing kind of like a pharmacy deal through semaglutide at a much smaller price. And so right now, that is the avenue that's open, and so that's the avenue we're taking. And that's what happens a lot. It's like, what's the avenue that's open? But I got some patients, they will shop an insurance plan specifically to look for which of these is covered. And they do a good job with it. All I have to do is essentially do I get help from my awesome nurse, Allie, who helps me do PAs to get those things covered. You know, so we walk through that, and really just having them come back and check. But if I told you that if insurance company is going to cover an obesity follow-up, they do not, you know, so they don't cover it. And so a lot of times it's like, okay, well, maybe their cholesterol's high, or we talk about something else. But yeah, if it has to be cash pay, which is just crazy, because that's, if you had to pick two of the biggest problems, like that's one of them, and then like the smoking and that kind of stuff.
So how has been your experience with the GLP-1s? Like, do you feel like they work for your patients?
Yeah.
Like, what are some of the things you've noticed?
I would say they do work. Very rarely, I would say maybe 2 out of, like for my diabetics, they are like awesome, 100%. Very rarely do I get side effects. For the weight loss ones, a lot of times in order to reach the goal and the numbers that the drug companies recognize, you have to hit that max dose. And you got to walk through the process to get there. But yeah, I would say that for the most part, I mean, I had one patient in a year that lost 60 pounds, then he weighed 280. That it is definitely beneficial. Now, the thing that I tell my patients whenever we get on that is like, you don't want to continue this forever. Like you want to build a habit once you get to there. And then whenever you get off, like you have to maintain whatever it is that caloric intake was. And that's the big hurdle that you reach too once you get off there trying to get off those medicines because it does return. The appetite does return. And so being disciplined about what your intake is and then making sure you're getting all the adequate vitamins and stuff like that. Yeah, yeah. But yes, 100% they do work.
So I think you're right. There are a lot of patients who are on the GLP-1s in which it works, but then once they get off of it or they can't afford it, they gain the weight back.
Right.
Do you have any tips that you recommend to your patients to kind of help them overcome that, or at least allow them to maintain that weight loss?
That is a hard one because how do you essentially procure discipline, especially when the craving is always there? Number one, I would say is recognizing at the beginning whenever you have that hunger, because if you can find something to do, or drink water, or for me, like whenever and I need to be better about eating and being healthy, but at the same time, like Metamucil is something that it's just absent, fiber that is not absorbed and absorbs water, and if you're drinking water, it's good for your bowels, and so that's an easy thing that hey, when you're hungry, like just try that. Now, people don't love the orange flavor. It doesn't taste very good. But at the same time, like you just try and get patients to recognize like, hey, you need to be aware that when you are hungry to try and find some sort of outlet, whether it be water or some other activity to try kind of preoccupy until it's mealtime. And then again, limiting calories is like in the portion size is another thing that you try and do too.
Now, do you ever suggest a weight loss surgery? Is that an option for some patients?
For
What are your thoughts
sure.
on that?
Yes. Now, again, will insurance cover it? So I have some patients that, I have one guy that's 500 pounds. And I tried to get everything under the sun covered for this guy. But in reality, if he could do surgery and lose the weight, it would change the longevity of his life. Whereas right now, I'd be worried, how long he would be here and how much stress he's putting on his heart. Definitely people who have increased risk of comorbidities, like specifically if they are pre-diabetic going to become diabetic, those are people that would benefit long-term wise, from getting these surgeries. And so, at number one, if you can get and prove that they need and insurance will cover it, then I'm all on board. I know there were some patients and nurses that I had when I was in residency, like they would go to Mexico to do the surgery. Now, I'm not necessarily saying that. I'm just saying, yes, there are benefits whenever you get it done.
So a lot of people ask me about weight loss hormones.
Okay.
Do hormones play a role? Thyroid hormone, adrenal hormones, things like that. What is your thought on that? Do they play a role in terms of appetite, metabolism? Is that a big component when it comes to weight loss?
I think yes, for sure. Like if you're hypothyroid, like 100% you're going to gain weight. But stress too, and the cortisol release, like yeah, people who are stressed naturally are going to have elevated cortisol, and they're going to want to eat too. Yeah, I would say as far as all the other adrenals, like unless there's some sort of tumor that's pushing that, such as a Cushing or something, that would be kind of the one that you would look for. But you'd also have other signs. But just for regular stuff, obviously you need to check thyroid. That is an easy problem to fix. I have an example of a patient, he wasn't borderline, but his TSH was, 6-7. But we talked about multiple different weight loss. And so his thyroid antibodies were negative, and so I was like, okay, well, we might not try it, see how you do. In a month, he said he's already lost, 10 pounds, and so with minimal adjustment as far as it. So he's probably on his way to becoming fully overt hypothyroid, but at the same time, it's like, hey, this is helping him 100%. So
I think people who have who need weight loss, they know what to do. They know to eat better. They know it's portion control. They know it's diet. They know it's exercise. But for some reason, people still can't seem to lose weight. What do you think is maybe some of the reasons why? Is it just the fact that maybe they're not as disciplined as what they think, or are they overeating and intentionally, or what? We all know, but why can't we all do it?
Right. And so I would say it is a bit of all of that. And so, yes, 100%, we know we need to eat healthy, but doing it is definitely the hardest thing. Yeah, I would say if you could find the motivational interview or the medicine that would make that, that's why the GLP-1s are so good, because they do affect your appetite and you don't have to do anything for it. Like you literally just don't have an appetite and then you eat and portion control. Man, if you could come up with a drug that would just make it to where you just weren't hungry, that was oral, you'd be making a lot of money. I'll tell you that.
Oh, there we go. That's what we got to do.
But maybe hypnotization, hypnotizing therapy may be an option. But yeah, really, it unfortunately, you have to have the discipline. That's the biggest thing.
Yeah, that makes sense.
Yeah. Or sometimes getting in groups. That's one thing that I've noticed, to have people who hold you accountable. That's an option too, but you have to have that whole group support. Yeah.
Perfect. So a lot of people go to these boutiques. They go to these places around town that have certain concoctions of different weight loss options that are out there that may or may not be FDA approved or may have different ingredients in there. What is your opinion on that? What should people watch out for? How should people approach that?
I would say that number one, the onus is on you to essentially make sure as a patient, you're expecting this provider to give you something that's not going to hurt you. But you have to be careful, and I would just do your due diligence, do your research as far as what's in there. If it's vitamin B12, that's not necessarily going to be that big a deal unless you're doing it a lot. But the compounded formula too, you just want to make sure that if you are doing that route, that you're getting it from a reliable pharmacy. That's kind of the big things that I would say. Just do your research whenever you go and get these things.
Have you noticed any bad effects that you've seen in your patients who've done that, or you've heard stories of people who've maybe gone to these places that maybe had a unfortunate, it didn't work out well?
Most of it wasn't boutiques. It was more of the compounded that was coming out of somewhere that wasn't supposed to be. They got cellulitic infections.
What is that?
Infections in the skin, from where the injections were. Those were things that I definitely heard. And then as far as did the medicine work, sometimes it did, sometimes it didn't. But, and then it's not a lot of side effects, but mainly it's more of the concern, are you getting the right stuff? Is it the medicine that you're getting, or is it something that's been essentially bootlegged? Yeah. But if it's from a reliable pharmacy, I think, they do a good job in that. Yeah.
All right, well, let's end this on some fun questions that I think me and my audience want to find out about you. So, if you weren't a doctor, what would you be doing right now? And I think I know the answer, but what do you think it would be?
I kind of already told it. If someone would pay me even a small amount of money, I probably would be fly fishing. That would be something. I do also like to barbecue. And so,
what do you like to make? What is your barbecue?
So I kind of push a little bit as far as the cost, and so I'll do prime rib, I'll do tomahawk. Nice. So it is kind of expensive, but usually they turn out pretty good. But it's kind of hard to mess up that quality of meat. But I do enjoy doing that. And then, watching college football, if someone would pay me to be an analyst, I'd probably do that too.
That'd be so great. Oh my God. What a gig. Oh, that'd be such a great gig.
Yeah.
Be a fly fishing barbecue analyst. I mean, you would totally destroy McAfee. Absolutely, you would.
That would be fun.
So your team would be TCU though, right? You'd be like pro.
This year, I am a Tech fan. 100%. I'm on board. I am sold. They did really good, and TCU has just let me down. So
listen, I'm a Longhorn fan. And,
okay, I'm sorry.
Yes, I know. I am sorry as well. We 15 years at least of hype and then just despair. I understand.
Yeah, you get it. You get it.
I get it. So second question, what is your doctor's superpower? What would you say that your staff tells you you are just awesome at or great at?
I would say it's probably listening. In this day and age, we really do try, and it's all in general numbers, pushing numbers. And so I do try to listen very well to my patients, and that's kind of what I feel like I do the best. And it's one of those things as far as balancing time. I do take notes home, which almost everybody else does. But there are times that I am literally listening, not writing anything. And
That's
just
so hard.
Opening. Oh yeah,
it's hard in this day and age.
Yeah, but I mean, I do catch up it on the back end. If it's just a cough cold visit, that's not a big deal. I can do that in a second. But for complicated older patients, I think it's important to go through and listen to what they have to say, because a lot of times, there's something that's been missed at some point as their workup has gone through. So. Yeah, I would say listening is my superpower, but yeah, my wife may disagree. I don't know.
Now, if you give your patients one piece,
yeah,
I know exactly right.
I'm gonna get
if there could be one piece of advice you give your patients, what would it be?
I would say the biggest thing is be proactive, whether it is, and most focused on your health. It's much better if you caught things when you were 28, than when you were older. And so whether it's being proactive as far as, going to get your blood pressure checked or doing your annual lab through work or doing your colon cancer screening or not doing anything bad for you, specifically smoking is kind of a big thing. But just trying to take care of yourself early rather than later and catching up on things, that have now shown their head. Those were things that I would say, just be proactive in your health.
Yeah, absolutely right.
Yeah.
Last question, what is the most unexpected thing or funniest thing you ever had with a patient encounter?
Okay. I mean, I did think about a few of them, but the one, it still kind of stuck with me because I was a teacher before, and so I went to residency, fairly recently, and I would say that the biggest thing is one of my patients, his blood pressure came in, it was 160 over 100. He wasn't on any
that's
meds.
high.
That's high.
Yeah, that's high.
That's high. Just for and so he was like, "Well, phentermine helps my blood pressure, and phentermine is a stimulant medication, and it does not help your blood pressure.
It does not. No,
not
it does
at
not.
all." And so sometimes you run into patients that are drug seeking and that, but this was more a genuine. He was trying to lose weight, but it was like, okay, that's not. And he was like, "It is for my blood pressure," and I'm like, I can't do that, but at the same time, maybe there's something else that we can do. But that was probably one of the strangest things, because someone at some point told him, to say that.
So how'd you convince him?
I told him, no, I can't do that. I'm sorry, I need to do an EKG on you and get you on blood pressure medicine. So he was kind of disappointed. It does happen sometimes, but yeah,
it happens.
that was one of the craziest things that I've heard. Yeah.
Well, Will, we had a great conversation. I want to thank you for joining our podcast. You gave a lot of great information, and I think the key of the message is prevention is key, as you mentioned.
Right.
If you can prevent cancer, heart disease, obesity, it's just so much downstream benefits you can get, and it's hard, but I think you've done an excellent job of telling our patients that. So thank you for that.
I appreciate it. Thank you for having me.
Mm-hmm.